Hey guys, welcome back to my channel. Let's do a quick revision on thyroid disease in pregnancy. Okay, so basically, in pregnancy, what happens is this is the hypothalamus, which is in thyroid releasing hormone. Then it acts on pituitary, which releases thyroid stimulating hormone, which acts on thyroid gland, which releases T3 and T4, which has many effects. And one of the effects is uterus, which is the main concern. Okay. So, maternal thyroid hormone passes placenta by 12 weeks. Okay, even the HCG hormone act as a thyroid stimulating hormone because it has same alpha unit. Free T4, 3T will be constant, whereas T3 and T4 will be increased. Okay, even thyroid binding globulin is increased during pregnancy. Okay, now, first we learn about hyperthyroidism. What is that? Hyperthyroidism. So, incidence is 0.5 to 1.5. Okay, 0.5 to 1.5. Here, the female will have some heart failure. There will be exophthalmos. You can see tremors on the face. A goiter can be seen. Okay, so goiter is seen in hyper and hypo both. And TSH will be hyperthyroidism. So, T3, T4 will be high. So, TSH will be low, less than 0.1. Free T4 will be high. If it is high, it is known as overt hyperthyroidism. Okay, so what is the treatment you'll give? Propyl thyroxine you'll be giving up to 16 weeks you can give. Okay, from the second and third trimester you can go for methimazole carbimazole. Dose is 10 to 20 milligram per day. Loading, then you will follow by 5 milligrams. Okay, what are the side effects of methimazole? Methimazole has side effect of esophageal atresia, choanal atresia, and aplasia cutis thin. Okay, and in case of hyperthyroidism, you can have TRAB antibodies positive, which is associated with Graves' disease. Okay, what are the maternal complications? Abortions, preterm labor, preeclampsia, and heart failure. Whereas fetal complications, you have epilepsy, autism, and FGR. Okay, fetal growth restriction. So by using methimazole, you can have leukopenia. Then you can continue the treatment. If she's having a granulocytosis, then you should stop the treatment. Okay, that's about thyroid hyperthyroidism. There is a condition as thyroid storm. Thyroid storm means the T3, no, basically more T3 is going on. So we need to stop the conversion of T4 to T3. Okay, people will have heart disease bradycardia, and they will land in ICU. Okay, for this patient management is propyl thyroxine is given so that it will stop this conversion. So 1000 milligram, then 2000 milligram 6 hourly. 1 to 2 hours after you'll start the iodine. Sodium iodide can be given. If any allergics, we can give lithium carbonate also. Dexamethasone has also been given. These all will stop the mainly T4 to T3 conversion. Okay, that's about thyroid storm. Coming to hypothyroidism, hypothyroidism incidence is 0.2 to 1.2. Like hyperthyroidism, I told now, if you see hyperthyroidism here, it is 0.5 to 1.5, but hypo is 0.2 to 1.2. These are all global incidence. Okay, but India incidence according to Fox is 1 or 13%. Okay, like hyper is associated with Graves' disease, hypo is associated with Hashimoto's disease, where anti-TP antibodies are positive. Okay, here you'll give levothyroxine 1 to 2 micrograms per kg per day, and 4 weekly you'll test the TSH antibodies, TSH test. Okay, TSH levels. TSH target should be 2.5. If she's already hypothyroidism, then you'll increase the dose of 2.5. According to Foxy, you'll increase the dose by 30%. Okay, according to normal, it is 25, but according to Fox, it is 30%. And the female will be very heavy weight, there will be alopecia, there will be hypothyroidism, cold intolerance, all the symptoms. Okay. Subclinical hypothyroidism incidence is 3%, and so most common is only subclinical basically. Okay, and iodine in pregnancy should be 250 micrograms per day. And see, if she's in pregnancy, she got hypothyroidism, then you will test TSH 6 weekly. Then after in pregnancy 20th week also you again test the TSH antibodies, TSH levels. Okay. Then if in pregnancy we give gestation hypothyroidism and we give 50 micrograms per day, then after delivery you stop the treatment, then you do TSH after 6 weeks NC. Okay, this is about thyroid disease in pregnancy. Hope you can write so many points with this. Okay, thank you.